Hi everyone, Dr. Uman and I here talking all things coronavirus. So as far as it stands today, we're at about 255,000 cases worldwide, 923 in Canada, and about 139 here in Quebec. So the numbers keep rising. We've been getting lots of questions through email, Instagram, Facebook. Really good questions. We appreciate it, and we hope you guys keep sending them in and sharing this with your loved ones. So why don't we just jump right into it?
Okay, thank you, Dr. DeLiello. So I think the number one question we're getting recently, the phone lines are blazing with it today, is can I be prescribed Plaquenil for the coronavirus? So a great question. A lot of you have asked us this question. So let me start like this. The President Trump has misspoken about the FDA approval. So the FDA has not in fact approved Plaquenil or chloroquine or hydroxychloroquine for the treatment of coronavirus disease. Chloroquine is actually an anti-malarial drug, an old anti-malarial drug that is approved for that use, and its brother hydroxychloroquine, some of you may know it by the name of Plaquenil, is still being used for autoimmune diseases like rheumatoid arthritis or lupus. Now, some countries, of course, due to the different situation they're in at this moment, like China, South Korea, Italy, have in fact approved chloroquine or hydroxychloroquine for the treatment of coronavirus disease. That may change here, and as we know and as we've been saying, the situation is changing hour to hour. This is based on a study that came out of France. Now, the situation is very dire over there, so they did the best they can with what they had in a very difficult situation. It was a very small study. There was only 20 people. It didn't follow the usual rigors that are required in order to make sound judgments based on giving in humans these kind of medications, even though they're approved for other indications. But that small study, given the limitations, did show some good benefits in certain populations. Now, there are enough infectious disease experts on the other side of the fence that say, no, we shouldn't be using it at this time. We need better trials. Why are they saying that? Well, there are some difficult and rare complications, one of which could be blindness. We have to... with extended use, we have to be very careful with those with cardiac disease, those who are diabetic. And another consideration is that are we, in using this drug before it's been formally tested, are we taking our eye off the ball and maybe waiting for that to work while better treatments might be available? Might it be distracting us and slowing us down from more effective treatments that are available while we wait for this to work? But that situation is unfolding hour to hour. I think that's all.
Yeah.
We'll leave it at that.
So one of the questions that I got was, so if I order food from the grocery store, do I have to wipe down each article? Could I touch things with my hands and then just wash my hands? And also, how long does the virus last on money? So really good question. In fact, there was an article that came out in the New England Journal of Medicine that was looking about how long the virus remains on surfaces. So it was looking specifically at plastic and stainless steel. It says that it could stay for about 72 hours. And on cardboard and copper for about 4 hours. Of course, the viral load and the amount of virus would go down during this period of time, but that's sort of the evidence that we have thus far. Personally, what I would do is I would give things a quick kind of wipe down with a Lysol wipe and then wash my hands. Theoretically, you could just kind of wash your hands after every time you touch it and put it away. But then if you're going to be constantly, if you're going to put it away, then for the next 3 days, you kind of have to either not touch it or remember to wash your hands every single time you touch those items and not touch your face in the meantime. So that's what I would do. I know it may be a little bit overkill. Listen, I understand that. But so far, we kind of have to just react with the information that we have thus far, and this is what it is.
Yeah, that's a great question. Here's another one. Is everyone in the world at some point going to be infected with coronavirus? That's another difficult question, challenging. Nobody knows for sure. It's another $1 million question. Early predictions are, we think, somewhere between 30 to 70% of the population. So let's say about half of the population worldwide may be infected with the virus. Now, always keep in mind, still we know somewhere between 95, 97% will do very well, will have mild symptoms, will recover, even though the numbers are large, but we do worry about that few percentage when we're dealing with huge numbers like that. So that's the best information we have. Nobody knows for sure.
Another great question. So my husband and I just returned from Florida. We are self-quarantined for 14 days. Could we still go out for a walk as long as we keep our distance from everyone else? So it's a question that a lot of people have been having. And in terms of the Quebec guidelines, there's nothing really strict. So I was looking more at what Ontario is doing. And right now, what they suggest is as long as you don't show any symptoms or signs of infection, no cough, no fever, nothing, you could still go outside and go for a walk. You could walk your dog, but you have to maintain your distance at least 2 meters away from anyone. Avoid crowds, avoid going to public spaces, the park. Try not to stop and talk to your neighbor, or I've seen it. I went for a walk yesterday. I saw people talking across the street from one another. That seems pretty safe. But as long as you maintain your distance, don't touch anything, go back home, wash your hands, it should be okay. Now, if you start to show signs of symptoms, that's another thing. Then you have to completely isolate yourself. So no going out for walks, nothing of that sort.
Yeah, I think that makes a lot of sense. Like Dr. Diliello said, it's hard to give blanket statements to everyone that's listening and watching for all age groups, all medical conditions, all risk levels for coronavirus disease. So I would say that we have to use some of our common sense also. If your exposure to coronavirus, the reason you're isolating yourself is high, then you certainly don't want to be leaving your house and going far away from the perimeter of your house, because you're risking exposing other people more or less vulnerable than you to a bad situation. Likewise, if your medical condition is serious, the more serious it is, the more underlying chronic medical conditions you have, the more you want to limit your activities. So we can't give you firm, hard and fast guidelines at this point, and government regulation and public health policy may change. If we head towards lockdown, then that will become clear. Nobody can leave their house.
Another question we got. So despite making certain provisions, so regular hand washing, wiping down shared spaces, my employer still wants us to show up to work. So I know there's still a lot of people out there that are working. As it stands right now, the government of Quebec is still allowing certain stores to stay open with certain restrictions. From the medical point of view, we're saying still, if you're above the age of 65 or you do have an underlying medical condition, something that may be suppressing your immune system, in this case, you have a good reason to stay home, absolutely. For people that are otherwise healthy, it's a little bit complicated. I think things are gonna change from week to week. As it stands right now, it still seems safe for people to be going to work as long as, provisions are done and it's not just kind of the same as it was before.
That one is important.
Yeah.
And I think we'll just end with, if you have not received yet, or if you haven't, if you would like a copy of one of the guides, the coronavirus guide, and there are other ones talking about social distancing and self-monitoring and self-isolation, total isolation, you can email us. We'll send you some copies of that. I almost forgot that spring is officially here. And I think we need that sign of hope and rejuvenation at this time with all of this that's going on. I'm gonna hold on to spring as a time when hopefully we can rejuvenate, have a new spin on this, and the virus really settles down. So goodbye, be safe, and we'll see you at the next segment.